Let's learn about ulcerative colitis, a type of inflammatory bowel disease. So ulcerative colitis has been caused by autoimmunity, where the individual has the family history of the ulcerative colitis, or else there is a genetic mutation, which basically leads to an hyperactivated state of Th2 helper cells, whereas in the Crohn's disease we have actually see there is an hyperactivation of Th1 helper cells. Once this hyperactivated Th2 helper cells have been stimulated by smoking or else Western diet, this basically starts to release a cytokine, which is your tumor necrosis factor, and this tumor necrosis factor, being an inflammatory mediator, starts the inflammation, which ultimately results in submucosal ulceration. There is an involvement of epithelium, lamina propria, muscularis mucosa, as well as submucosa. Here there is no involvement of muscularis externa, as well as also there is no granuloma formation. This was about the microscopic features. Moving up towards the classic finding, ulcerative colitis usually occurs in whole colon, but the most common site is rectum, where it initiates and continues upward and progresses throughout the colon till the cecum, and that basically is called as pancolitis. As well as rectum being the initial part to get affected, the person will be presenting with hematochezia. Towards a classic finding of ulcerative colitis, initially rectum is affected, the person will be presenting with lower left quadrant pain, as well as the person will be having tenesmus, which basically results because of decreased rectal motility. So tenesmus is basically a feeling where the individual actually has an urge to poop, but basically doesn't evacuate completely. So this was all about ulcerative